We often hear that insurance controls your healthcare, the decisions that doctors make. And I really want to jump into that today so that people understand that the insurance company has set up two big hurdles or roadblocks, one called prior authorization and the other called step therapy, that impact your physician's ability to move forward with the care that they feel is necessary. So prior authorization is a process set up by the insurance company in which they demand that the physician contact them and work with them directly to get their approval for whatever surgery, x-rays, procedures, medications that we want to prescribe. So prior authorization process, we don't know what needs prior authorization. That's the frustrating part. So when something's held up in your doctor's office, it's most likely because we have requested this service for you, but it is sitting in the prior authorization department of the insurance company where someone has to look at their guidelines, again, established by the insurance company to see whether or not this treatment is indicated. I'm always frustrated with prior authorization because it's not there as a safeguard or a safety net for the consumers of that insurance. It's there to safeguard the stakeholders in that insurance company to obviously decrease unnecessary expenses in their mind. And in doing so, that's denying care to patients and forcing doctors to maybe pick an alternative that isn't the standard of care or isn't medically guidelines based, which is what we all should be holding ourselves to that standard. And most doctors do, is we know what our guidelines tell us. And unfortunately, they don't always align with the insurance company. So things get denied because it doesn't interest their financial bottom line. So prior authorization in the past used to be for really big things. If you're going to have major surgery or you wanted to try something that wasn't in their mind the standard of care but had been scientifically proven, so it wasn't necessarily in their care pathway. Now prior authorization is required for everything. If I want to get an MRI for a patient, that needs a prior authorization. Ultrasounds, prior authorizations. Simple stone surgery. You have an obstructing kidney stone. I have to call and see if it's okay to go operate on you. It impacts hospitalizations. They're constantly checking with insurance about length of stay because you can't stay in the hospital longer than length of stay guidelines. Again, unless we call the insurance company and ask for their permission. So I'd say 99% of the time, a doctor wants to do for you what's in your best interest. And when we order a lab or order an imaging exam or recommend a surgery, it's in your best interest. But there have been situations where the approval process gets held up so long by the insurance company that the patient may choose to either forget about any kind of treatment, or we as the providers have to alter our treatment pathway to best take care of that patient as well as to keep it within their financial constraints. And that may result in not the standard of care. It's not the best thing that could have happened to you. My advice to patients is if you know that your doctor's office is stuck in this prior authorization hell, so to speak, this prior authorization merry-go-round, what I do is I try to engage the patient. You pay for the insurance. This is your commodity. You're paying for this service for them to cover your healthcare needs. I think the most effective thing that patients can do is to jump on board with the doctors. And as we're working the authorization process from our end, that patients contact their insurance and just keep contacting them and discussing this with them and explaining to them this needs to be done and I pay for insurance. Step therapy is another way that insurance companies can try to control what medication's prescribed or what treatment is offered initially. So step therapy is fail first, then we'll give you the medication that you knew in the beginning was the right one for the patient. So step therapy means that I prescribe a medication that I know is dangerous, has awful side effects, and may not be as efficacious or effective as the medication I really want to prescribe. But in order for me to get the prescription that I really want you to take, I have to prescribe the other medication first. And then knowing the outcome, which is that it's not going to work or you're not going to tolerate the side effects, I then can tell the insurance company, I did what you asked me to do, and now I can take the medication and prescribe it to my patient, the medication that was already in their best interest. And in doing so, again, that bogs the doctor's office down with unnecessary phone calls. And it also impacts the patient's health and their treatment pathway because it delays your treatment. So I think if a doctor is honest with the patient and lets them understand that, hey, this isn't the medication that I really want you to have. This is the medication your insurance wants you to have. I'm not optimistic it's going to work so great, but we have to do this. So I think it's important that the patient and the doctor are on the same page that this initial prescription may not really be the one that the doctor wants to give you, but it's the one that they have to give you in order to get to the medication that they know will work and will be the safest for you. So unfortunately, there's really no getting around step therapy other than to play the game. I think one of the important parts of a video like this is that you understand now that something called step therapy exists. And so if you're being prescribed a new medication, you can ask the doctor, is this part of a step therapy program? Are you giving me this medication because it'll automatically be covered by my insurance, but may not be the best medication out there? You can ask, are there better medications with fewer side effects? Generally, as medications progress, they get what I tell my patients, they get to be cleaner and cleaner. So the older medications are usually the ones that insurance wants us to try first. It's the newer medications that actually are better for the patient because most of the side effects and the adverse effects have been cleaned, so to speak. So these medications are much safer and more specific to your treatment issue. So I think it's just important to ask the doctor, is this part of a step therapy? Or again, are you prescribing me a medication now because it's cheapest, but it may not be the best? All of this information is completely overwhelming. I've been doing this for 26 years. This is knowledge that I've accumulated, not only as a patient, but as a doctor. And it really can be difficult to understand what to ask the doctor in that short period of time. So I'd love to pull together a list of these topics, of these questions, of things that you should ask your doctor. If you're interested in receiving any of that information, just leave a comment below and we will be happy to send you this script. The more I tell you, the more empowered I hope you feel. And I hope that this helps you navigate this really broken system. So the mechanisms that insurance have put into place have not strengthened the bond between a doctor and a patient. It's actually created some animosity, some mistrust, some question of whether the doctor is really doing their job for you, because prior authorization and step therapy do nothing but delay your treatment and potentially expose you to harm because the doctor is forced to try something that's in the insurance company's best interest, but not yours. And that often exposes you to risks that you shouldn't be exposed to. So I hope today has helped everybody understand that the insurance company is controlling what your doctor wants to do for you in a majority of situations, with prior authorization and step therapy being obstacles. And I hope just understanding that when your care is delayed, that it isn't the doctor who's delaying that care, it's the insurance company. And what you can do is to work with the doctor's office to say, how can I help you? How can I contact my insurance company to also advocate for myself? Because you as the consumer of that insurance has more power actually than the physician does, because they work for you. So again, the insurance company works for you because you're paying for their service. Their goal is to save as much money at the end of the year. But if they get enough pushback from their consumers, then suddenly they understand that they've been exposed, that their process of delaying things has been recognized. So I think as a takeaway, what I try to do with my patients is when it comes to medication, I ask them to jump on their formulary on their insurance website and tell me which medications do they approve that are in this class. So high blood pressure medicine or whatever it might be. They'll tell you what they want a doctor to prescribe. So that stops the prior authorization process or step therapy if the doctor's in agreement with that. The second thing you can do is if a procedure or an imaging order is being held up, you can again contact that insurance company and say, I understand I'm supposed to have this x-ray done next week. This is to check if I have cancer. Why is it not being approved? So again, this is a collaborative event between you and your doc. Don't see your doctor's office as being the ones holding up your care, because the majority of the time it's out of our hands too. I hope you all enjoyed today's video. If you did, please like or share. If there's any topics you want me to cover in the future, just please leave a comment below.